A very good evening, all. I'm Aditi Lamba coming to you from a remote location in New York City. This is the Thursday night's Vision of Asia. Welcome to our daily South Asian news segment. We are bringing to you report on the coronavirus pandemic. Time of filming this episode, current numbers show more than 2.7 million cases in the world of COVID-19 and at least 186,000 deaths. In United States, the total number of cases remains more than 846,000 and 47,000 deaths. Again, urging all to practice social distancing and follow all guidelines of the CDC, remain inside and save lives. The World Health Organization today urged countries to remain cautious as nations around the world are considering on taking steps to ease lockdowns as the curve of the disease begins to flatten. The WHO warned that it should be slowly and only when there is capacity to isolate infection cases and trace contacts. Send us your comments on reopening from a medical perspective. If you are on the front line, email us on events@itvgold.com. In the United States, where hotspots such as here in New York City or New Jersey remain in lockdown, states Georgia, Tennessee, Texas, Ohio, Montana, and a few others are preparing to reopen in the next 2 weeks, as another week of massive unemployment claims highlighted the grim economic toll of the coronavirus pandemic. We will be bringing to you more from these South Asians living in these states in the coming days. And if you are there and would like to share your experience with us, you may connect with us on Facebook at ITV Gold as well. We hope for the safety as well as wellness of all. Also, sending our condolences for all who have lost their lives to the battle with COVID, especially those brave frontliners who sacrificed their lives. Let's hope the coming weeks bring in more hope for all of us. And on that note, tonight we have an exclusive Vision of Asia episode featuring renowned world spiritual leader Brahma Kumari's sister Shivani, who brings in a mindful perspective to get through the chaos of COVID-19. Global Indian Physicians COVID-19 collaborated featuring Brahma Kumari's sister Shivani finding calm in COVID-19 chaos. ITV Gold. Sister Shivani on how to remain calm these days right after a short break. Stay with us in Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lama and this is Vision of Asia, special report on coronavirus impacts and measures. This is a special episode featuring renowned spiritual leader and speaker Brahma Kumari, Sister Shivani. An online session was organized by the Global Indian Physicians COVID-19 Collaborative, which was recently launched, bringing together some of the biggest medical associations representing South Asian doctors and medical professions, including API and the Global Association of Physicians of Indian origin. The face-to-face session saw Sister Shivani interact with doctors from all across with uplifting ideology and tips of staying calm during the COVID crisis. Focused on challenging one's own inner positive energy, Sister Shivani reflected upon consumption of news on the pandemic facing us, the impact of well-being of many causing fear, panic, anxiety, and much more. Let's take a look.
How do we heal people when globally together we are creating fear and anxiety? So I personally feel we are sharing with everybody, but it's the healers which need to share it with the world, that if you want to heal people, if you want to finish this, if you want everyone to remain protected, then the one top responsibility of the world right now is to start creating calm here. If we have peaceful minds, calm minds, powerful minds, we will be radiating healing energy. When we do not have enough evidence of medicines and practices, then let's use the power of the mind to create the healing, because mind also is playing a role in the healing. But before we're able to radiate that message to everybody else, we as healers will first need to take care of our own minds. The need of the hour, first and foremost, is a change in vocabulary. Because of constant consumption of content from media and social media, and then of course you are seeing everything around you day in and day out, our vocabulary right now is not at the best vibration. So every word we are creating in our mind and every word we are speaking out is at a very low vibration globally. Tough times, challenging times, crisis. These are our normal vocabulary now. Every two sentences seems to have these words in the vocabulary. And when our constant vocabulary for a month or 2 months starts becoming low energy vocabulary, then it starts taking a toll on our energy field. Which means the first thing, it starts taking a toll on the energy field of the healer, just the vocabulary we are using. And then with that energy field, you have so many situations to take care of, new ways of healing, methods which are yet not clear. Like Dr. Sybil said, you have to wear that gear, which is not the most comfortable one. You're not able to touch people, so you have to change your way. So much more to be done outside. So the more we have things to manage outside, we need a very high energy vibration here, and which will only happen if we first start changing our vocabulary, which means our every thought and our every spoken word. We all know the power of blessings. We all know the power of mantra. We all know the power of affirmations. So, what is mantra? What is affirmation? What is blessings? They are high energy words. They are high energy words. So, even when there was any situation in life, somebody would give us a mantra. They say, you chant this mantra. Oh, but I'm not well. They would say, okay, never mind. You chant this mantra is for health. So what did they ask us to do? They asked us to think and speak high energy words that would radiate healing energy. All of us right now are praying, are chanting, are meditating. We're all doing that in our own ways. But how much time are we able to do that? 10 minutes, 15 minutes, 20 minutes. Rest of the day, we are on the field. So our affirmations and chanting and mantra cannot be restricted to 15, 20 minutes. Our vocabulary now would need to be a vocabulary of affirmations, blessings, and mantra, which means high energy words, because it is our high energy words and thoughts which will become our protection.
Sister Shivani emphasized on the importance of spiritual practice and meditation to calm down anxiety and stress of the coronavirus pandemic. She asserted on energizing one's mind and creativity during this time period and to maintain positive environments and consume positive content. She also suggested on 15 minutes meditation daily to internalize ideas and thoughts while also focusing on good nutrition and healthy eating habits.
COVID will be a closed chapter after a few months. But the impact the fear and anxiety is creating on the minds of people might not finish off in a couple of months. And what is happening in their minds is also affecting their bodies, it's affecting their relationships. There has been a drastic rise in mental health issues in India, what I know of, in the last 1 month. 20% rise in depression and mental health cases in 1 month. High rise in domestic violence, child abuse in 1 month. This is a sign of weak emotional health. So let's start taking this mantra that Sankalp se Siddhi, my thoughts manifest. Sankalp se Srishti, my thoughts create my world. And just take charge that from today, I will not create those normal thoughts and words which the world believes is normal, because that's not normal. Crisis means I need to create better thoughts than what I was creating even before, higher energy thoughts. Now, to start creating high energy thoughts, what should I do on a daily basis? Simple. For some time, please do not consume information coming from media. We've heard and read and watched media quite a bit in the last 1 month. Like Dr. Sybil just shared, the number of WhatsApp messages, and in every hour was some million, and half of them are related to COVID. If somebody keeps watching, reading, listening, it's the truth. It is the truth. But if I keep watching, reading, listening, content which gives me fear and anxiety, then it will be difficult to be calm over here. As healers, you only need information which is medical. But we do not need information about statistics, how much it's spreading, what happened in this country, which city has it reached. Not really. because your responsibility as a healer is to keep your vibrations very high and take care of only those people who are in your region, your territory where you are there. By consuming information of the world, you're only lowering your vibration and not going to your hospital in the best of energy, which is needed for healing. Even if we want to know what's happening in the world, it takes just 5 to 10 minutes, and that too written information. Print media, audio, and visual. All three have different impacts. So definitely not watching visual media, because that has deep impact here. Print media, 5 minutes, we will have all the information of what's happening in the world. But if repeated visuals, same words with a lot of emotion around it, not good for our energy field right now. Medical information, everything. But what's happening in the world otherwise, we don't need to consume, because right now our own protection is healing for a lot of people. So one is to protect ourselves from media, social media. Second is, even though you're going to be very busy nowadays, but still, it's a part of your healing. Please keep 30 minutes for yourself every morning. You're going into the world where the vibrations are low. It's like somebody going out to extinguish the fire. They can't walk into the fire like this. They have to protect themselves. Similarly, walking in to the disease, you're protecting yourself. But walking into a global vibration of fear and anxiety, you have to protect yourself. And for which 30 minutes every morning is always needed, but right now it should be mandatory for each one of us, that we begin our morning with 30 minutes only for the self, consuming very, very pure and positive content as the first thing in the morning, which means consuming content of peace, compassion, faith, security, miracles in the healthcare industry. We're just studying that. If we flood our mind with positivity for even 30 minutes in the morning, it will raise our aura, our energy field. Meditation for at least 15 minutes in the morning. Even for those who've never meditated before, this is the time we can do it. And if in the morning, we all pray, we all talk to God. But if you could just start experimenting with this, talk to God on a personal level. Talk about everything that's happening in your life right now. Tell God about every patient that is there in your hospital. Use that energy, invoke that energy to do the healing process with you. Surrender yourself to be His instrument and just say, okay, I am your instrument. I'm not completely sure about what has to be done here. You use me throughout the day. Just invoke that highest power and allow Him to use you as an instrument. Like you use instruments, He will start using you. This is the time to use our spiritual powers.
It's time for a short break on Vision of Asia, Voice of the Community. Stay with us. We'll be back shortly. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. This is a special episode featuring Brahma Kumari's sister Shivani, a renowned world spiritual leader, along with the leading medical professionals from all across the US. Focused on inner peace and mindfulness during the crisis, Brahma Kumari's is a non-profit spiritual movement affiliated with the United Nations focused on inner peace and strength. During this virtual session of the Global Indian Physicians COVID-19 Collaborative, Sister Shivani also highlighted upon the well-being of these medical professionals and healthcare workers on the front line across the globe who are in high stress and anxiety environments. She stressed consuming content of peace, compassion, faith, security, and miracles in healthcare industry during this crisis and flooding the mind with positive energy. Let's take a look at what all she had.
Even those who are sitting at home, they're only able to protect themselves physically, but they're not able to protect themselves from the vibrations. So we need that high energy aura right now. We need to raise our energy field. If all of us together raise our energy field, first, we are emotionally protected. Second, we are mentally protected. Third, that has an impact on our body. And fourth, most important, your high energy vibrations have a direct impact on your nurses, on your junior doctors, and it has a direct impact on the patients, whether it is COVID patients or any other patient walking into the hospital. These are not the times where if you say to somebody, daro mat, sab theek ho jayega, don't worry, everything will be fine. Words are not healing people. Words are not able to change the state of mind of people. But if you are here calm, which means you're vibrating at a higher frequency, and the person that you are meeting is stressed and anxious, but if you're at a higher energy, then the lower energy doesn't flow up, but the higher energy flows towards the lower energy and pulls that person up. So if you really want to motivate your people, energize them, protect them, empower them, words are not needed right now because words will not be able to do it, but our own energy field, which means our vibration. And our vibrations will create a soothing and calming effect on people. People will be in your energy space and they will get a feeling inside. It's difficult, but I'm sure everything is going to be okay. I'm 100% sure we're going to come out of this fine because that's a vibration that they will catch, they will consume that vibration from your energy field. So this is a very important responsibility every healer will need to play. And of course, with all the patients who are coming in, can't expect them to be coming in with the most positive state of mind. Even if they're coming to a hospital for some other ailment, there's so much anxiety about going to a hospital right now. So we cannot give them an assurance and say, oh, don't worry, you're protected, you're sanitized. There's too much doubt and fear here. So we just need to raise our vibrations, then the vibrations of our team, then the vibrations of our hospital. People walking in, the higher vibration will influence them and they will start feeling better before they actually start their treatment. So really it's the need of the hour to look at that aspect of life which we are ignoring completely because we are saying fear and anxiety is normal. Fear and anxiety is not normal. Fear and anxiety is a choice. It's a response that we are creating to the crisis outside. In the same crisis, different people create different responses. And it's not about COVID, it's always about life. Look at one situation which comes to a family of 4 people. One situation which comes to a family of 4 people. One family member will say, Kitni badi baat thi, which means it was such a big problem. Another one will say, Choti si baat thi. Yeah, it was a little issue. Third one will say, Kaun si baat thi? Ye to normal baat thi, which means that's okay. That's a part of life. 4 people in a family, same situation, respond differently to the situation depending on how they are creating their thoughts here, which means situations do not create our thoughts. Crisis does not create our fear. Our fear is our choice. And we have the power to choose something different. We have the power to shift from fear to faith. We have the power to shift from stress to calm. We have the power to shift from insecurity to confidence and certainty of everything being perfect very soon. What we think, we will create. What we create, we will radiate. And what we radiate will manifest. In Hindi, it's a very beautiful line. Sankalp se siddhi. Thoughts manifest. Sankalp se srishti. The world is created from our thoughts. Most of us have read the book Secret. We know about the law of attraction. Many of us have experimented with it, and many have seen the result of it, that thoughts manifest. Sankalp se siddhi hoti hai. Sankalp se srishti banti hai. If thoughts create my world, thoughts create my destiny and the destiny of the world, then what will happen when for 2 months, 3 months, the world together is creating low vibration thoughts? COVID will be a closed chapter after a few months. But the impact the fear and anxiety is creating on the minds of people might not finish off in a couple of months. And what is happening in their minds is also affecting their bodies, it's affecting their relationships. There has been a drastic rise in mental health issues in India, what I know of, in the last 1 month. 20% rise in depression and mental health cases in 1 month. High rise in domestic violence, child abuse in 1 month. This is a sign of weak emotional health. So let's start taking this mantra that Sankalp se Siddhi, my thoughts manifest. Sankalp se Srishti, my thoughts create my world. And just take charge that from today, I will not create those normal thoughts and words which the world believes is normal, because that's not normal. Crisis means I need to create better thoughts than what I was creating even before, higher energy thoughts. Now, to start creating high energy thoughts, what should I do on a daily basis? Simple. For some time, please do not consume information coming from media. We've heard and read and watched media quite a bit in the last 1 month. Like Dr. Sibyl just shared, the number of WhatsApp messages, and in every hour was some million, and half of them are related to COVID. If somebody keeps watching, reading, listening, it's the truth. It is the truth. But if I keep watching, reading, listening, content which gives me fear and anxiety, then it'll be difficult to be calm over here. As healers, you only need information which is medical. But we do not need information about statistics, how much it's spreading, what happened in this country, which city has it reached. Not really. Because your responsibility as a healer is to keep your vibrations very high and take care of only those people who are in your region, your territory where you are there. By consuming information of the world, you're only lowering your vibration and not going to your hospital in the best of energy, which is needed for healing.
And that is all for the show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. I am Aditi Lamba. This is Vision of Asia. Take care, be well, and stay safe.